Eleonore Pauwels is a senior program associate and scholar with the Science and Technology Innovation Program at the Wilson Center. She joins us today to discuss the Zika virus. Eleonore, welcome back. Thanks for joining us.
Good afternoon, John. It's a pleasure.
Now, a couple of months ago, nobody was talking about the Zika virus. How does what was an obscure virus now, in a short order, become a global health concern?
Yes, a virus only a few knew about last year. Zika has exploded on the world stage. And it's a real battle we've now engaged against the Zika virus. It's a fight that marshals international, national, and local forces. In the US, close to $2 billion will be channeled through the NIH and the CDC, the Center for Disease Control and Prevention. And
is that enough? Is $2 billion enough? Sounds like a lot on the surface.
Yeah, it's difficult to assess. What you will need, there will be no silver bullet. So you will need a lot of different approaches. And something I've argued for a long time now is that we need to absolutely invest better in a form of a foresight capacity to actually anticipate those kind of threats. And propose a model of action and a model of answer that would actually be multi-level and that would involve not only experts but also non-experts. Mm-hmm. And that's something I really want to insist on, is that there are a lot of things we could do with the crowd, with different communities, with citizen scientists. We could basically harness the power of those crowds, of those non-experts, to actually help us monitor some of those threats.
Could you give us a specific example of what is the value that non-experts can bring to the table?
Sure. There were actually two citizen science projects that were developed around mosquito population control, one in Germany, one in Spain. And those are remarkable efforts. So basically, the citizens, go in their neighborhood, different landscape, and they scope, they screen, they find the mosquitoes, they use an app to take a photo. Sometimes they take a sample and then send that back to a research institute. That's going to be a big database to basically analyze what kind of species you have in your neighborhood in different ecosystems. And that matters because basically, according to the species, you get a different virus, mm-hmm. and according to the virus, you get a different mode of action and response.
Is there a way that, maybe using Ebola as a frame of reference, something that we talked about in terms of a global health scare, a potential pandemic, a deadly disease, where does Zika rank as far as public health threat? Do we know enough about it to have that sense of it?
Well, what I used to say about Zika is that it's actually a tragedy of the unknowns. So basically, there is something clear about this virus, is that we know very little about it. So we know very little about the virus itself. We know little about its transmission routes. You hear news about ways of transmission almost every day this month, and really little about its evolution, basically. So every day, scientists in the US and in the Americas are learning about the epidemiology of the virus. And for example, they are still trying to establish a proven link between the virus and microcephaly, as well as other neurological disorders. And that's what matters, basically, because otherwise, the Zika virus in itself doesn't present a health threat like a virus like Ebola, for example. The effects are pretty mild. The problem is really what kind of long-term impact it will have on your health and on the health of specific categories of the population, like pregnant women and young kids.
So even the serious birth defects that we've seen linked to this in Brazil and other places, that's not a guarantee, just if you contract the virus.
The link is getting really much stronger because with time, scientists and doctors had time to actually analyze the tissue of some of the newborns that died, presumably from an infection, of the mother. But still, it's really difficult to know basically if that's the only cause of the defect and to really trace when the infection was actually a problem. So we still need a lot of research, and it's really a systemic environment you have to look at. So basically you have to look at other viruses, dengue, yellow fever. Those are basically also being transmitted by the same mosquito, Aedes aegypti. And
the world's most dangerous animal, the mosquito.
It's actually a big killer. You would never think about it. And the problem is that And that's why I'm talking about the power of using the crowd and using every one of us as a form of early warning system. Is that this mosquito adapted and it became, it's not a nice expression, but it became the cockroaches of mosquitoes basically. So that mosquito learned how to live with us in the dark places, in our houses. It's really close and it feeds on human mainly. So the strategies we're actually using these days, spraying from plane, from trucks, it's like fighting Al-Qaeda with an old-fashioned army, basically.
And is the situation exacerbated by a warming planet? Do mosquitoes, we've talked about certain species moving farther north as climates change?
Well, basically, that's the deadly combination. As I was saying, the tragedy of the unknowns, but also the tragedy of urgency, because of a set of very systemic changes: globalization, climate change, mosquito migration. The virus is spreading at an explosive pace, and the pace is much faster than the time you need to develop a safe vaccine, for example. It takes a lot of time. I mean, from 18 months to sometimes a few years, especially in the case of Zika, that has some implication for neurological disorders.
What is the likelihood of enacting solutions that are not, I would call non-traditional? Things like genetic manipulation or fighting fire with fire, a genetically manipulated mosquito taking on the mosquitoes that carry the Zika virus. Is this anything that's close to happening? Or is this more still the stuff of science speculation or even science fiction?
That's you're basically at the frontier between what could be possible and what could be science fiction too. So that's why it's so difficult to actually communicate about the Zika virus and its threat. It's because there is so much uncertainty, so much complexity, and in a way, not enough humility about our ability to master biological control and species. We tend to forget that, and we didn't, necessarily. We didn't have this capacity of foresight to link climate change with migration of different species and with migration and emergence of different viruses.
Talking about complexity here and an ability to connect the dots.
It's really how to tell a question, how to tell a story about the future and how to talk to people about uncertainty. But so as I was saying, there will be no silver bullet. So you will need manpower, first thing. So you will really need, people to go from houses to houses, in villages, in Brazil, in Central Americas, and eliminate all the breeding sites. That's going to be the first line of action. And that's how the US was really efficient at actually stopping a dengue outbreak in 2009 and 2010. You were asking about precedents. How did they do that? Mosquito squads, every day. 10 hours a day, going from houses to houses and really trying to find out where the breeding sites were.
This is really in the trenches, almost the equivalent of guerrilla warfare.
It's a guerrilla warfare. Some people even talk about, entomological warfare to refer to the mosquito. So basically, you will need that. And why not rely also on every one of us, basically? You see, we need to develop a culture of responsibility, a culture of foresight, a culture of raising awareness in this case. Because if you have one person in one neighborhood who doesn't take care of this problem, basically, leave breeding sites alive, those mosquitoes are going to be enough to start a new outbreak.
I'm sorry, the type of engagement you're talking about, the crowdsourcing or the citizen science, activating those potentials, how far along are we in that? Who's leading the charge in that regard? And are we just at the beginning of something that has enormous potential, or is there something underway already?
That's really difficult to assess, but basically it will require political will, and it will require, and that's something I'm really interested in, a new way of translating knowledge. Because you cannot call upon citizens to become, expert or to mobilize for every possible threat that's gonna come. So the whole of the elite, it's basically to kind of warn about new threats, develop that foresight capacity to anticipate and identify them, and then translate a good amount of knowledge that people can digest, own, translate into their own words, share between themselves, and then on that basis become active, watchdogs, basically, active fighters in those fights. And that's going to be the same. Basically what I'm saying here is that in this fight, how much will be left to technology and how much will be left to human solidarity? Because even if you refer to genomic tools, and we can start talking about that too, but even if you refer to genomic tools, you will need a form of awareness raising and a form of foresight in that case too.
A final thought for now, and I'm sure we'll revisit this, and my question sort of leads to how much we'll be revisiting this, is you've been very clear about the things we don't know, but based on what we do know, is this just the very beginning of this story? Is this a story that's going to be with us for some time? Has the Zika scare come even close to peaking yet?
No, and it will be with us for some time. And when it will not be Zika,
years?
Probably years. Again, that's really difficult to assess with
I'm
the amount of knowledge.
No.
But basically, I mean, we are going to see in the US a peak potentially in the summer, just because of the climate
Mosquito
condition,
season.
the mosquito season, and basically the best defense for Americans are going to be, air conditioning and window screen.
Stay inside.
but that's probably a good defense. Now afterwards, what kind of really efficient genomic tool or other technological tool we could imagine to use and reduce the threat, to reducing the threat, that's something we absolutely need to discuss with political officials, with public health officials, and with citizens, because basically you cannot unleash that power without having a form of vetting by different populations.
Eleonore, thanks for joining us. Just having this discussion is making me feel itchy, but it's an important discussion, and we look forward to speaking to you again as the story unfolds.
Thank you so much, John.
Take care.